Getting quick help for heart attacks is our cover story. Baptist Memorial Hospital DeSoto is working with emergency crews to improve their ability to assess patients on their way to the ER. Rod Starns shows you why that helps emergency room teams be ready when the patient rolls in.
Time matters when someone's having a heart attack. In emergency cardiac care, time is muscle because heart muscle dies when it's cut off from blood-carrying oxygen. So paramedics in North Mississippi are using new technology to help speed up the treatment process.
We're able to perform a 12-lead EKG on a patient that may be complaining of chest pain or maybe some kind of cardiac incident, and we're able to transmit it through a wireless laptop to the hospital for the ER physician to read.
Those transmissions are important for patients who may be suffering a severe type of heart attack known as an ST segment MI, or STEMI. Doctors believe STEMI patients have the best chance of survival if the time from their arrival at an emergency room door to when doctors in the catheter lab insert a tiny balloon to bust a clot is no more than 90 minutes.
In the past, we've had to wait until the paramedics who picked up the patient, they may get the EKG in the field. We wait till they get here before we see the EKG, determine that they're having this ST segment elevation MI.
As Director of Emergency Services for Baptist Memorial Hospital DeSoto, Dr. Stanley Thompson has worked on the EKG transmission project with the 9 ambulance providers that serve the facility. He says the hospital has cut its time from arrival to treatment to 30 minutes below the national average. That's because important preparations can be made by reviewing EKGs for STEMI patients before they arrive at the ER.
Now that we're receiving the EKGs by ambulance transmission, we're talking about getting that EKG transmitted. We're already activating the cardiology and the cath lab team, so when they pull up, the only thing we're doing in the emergency department is prepping that patient to go to the cath lab.
The earlier we can determine if it's an actual heart attack or that cardiac muscle is being damaged, we get that to the hospital. At the end of it, they're able to get them in the cath lab and get that blockage opened up to provide the oxygenated blood to that heart muscle and hopefully save some of that.
But receiving the EKG transmissions is only part of the equation, because doctors can only get the information if patients are transported by ambulance. No ambulance means no advance information, and that means it takes longer for diagnosis and treatment.
Most people who present to ST segment elevation MI, and they have the exact percentage, they don't call 911. They jump in the car and they drive. So what our next challenge is to do is better educate our community on the signs, symptoms, and risk factors for heart attack.
Those risk factors are typically the same for men and women. Age over 40 or 50, history of high blood pressure, diabetes, cholesterol, and positive family history of coronary artery disease. African Americans are also at higher risk. Heart attack symptoms include shortness of breath, nausea or vomiting, chest pain, which can include squeezing, tightness, or heaviness and may radiate to the arm, neck, or jaw, although the pain may not be quite as severe for women. Doctors say recognizing the symptoms of heart attacks and taking the time to call 911 for an ambulance will help save lives all over the Mid-South. For Smart Medicine, I'm Rod Starns.